Hey everyone, Sonya Jones here with HSHS Medical Group, and today I'm here with Dr. Balasuryia. Dr. Balasuryia, thanks for joining us today.
I'm glad to be here, thank you.
We are here today to talk about joint injections.
Sure.
Dr. Balasuryia, why would someone get a joint injection?
Sure. So a joint injection would help a patient, specifically if they're having pain in their joints, and not all types of pain will benefit from joint injections. However, mainly conditions such as osteoarthritis, rheumatoid arthritis, and even sometimes gout, pseudo-gout, those conditions can help with joint injections. And if you consider the shoulder joint, rotator cuff injuries can help with joint injections as well. Bursitis, inflammation of the bursa. So joint injections can help relieve the pain and help patients, become more active.
Okay, and what kind of joints do you inject?
I usually inject knee joint, the shoulder joint. So the shoulder, there's two injections that I would do. One is the glenohumeral joint, which is the main shoulder joint. Also the subacromial joint. Usually if patients have rotator cuff injuries, then I would inject the subacromial joint. And also I would do injections for medial and lateral epicondylitis, which is golfer's elbow and tennis elbow.
Okay.
And also I would do injections for trochanteric bursitis, which is around the hip area. I do not do hip injections, but the trochanteric bursitis is the inflammation of the bursa close to the hip area.
Gotcha. And what do you inject into the joint?
Sure. So mainly what we inject is steroids. So there's different formations, different brand names of the steroid, but as a general, it's steroids that we inject. And of course, we do add some anesthetic to the injection to make sure that they are pain-free while the injection takes place. Most of the time, we are able to inject, do joint injections without causing that much pain for patients.
Really?
Yeah. Yes.
Wow, that's great. And are there any side effects to the joint injections?
Yes. So side effects are rare, but we always like to mention this to the patient so they're aware of it. Main thing would be infection. Again, it's rare. We are introducing a needle to a joint, so there is a small chance of infection. Then also there is a small chance of bleeding that can happen, but we take great measures to try to avoid that, of course. And also a post-injection flare where you can have like a allergic reaction in the or inflammation, redness in that area in the skin.
Okay.
Another thing sometimes that happens is a little bit of change of skin color. Skin can become white. Sometimes that can last for some time. Okay. And then again, some of the bad things again rarely can happen is tendon rupture is another thing. But we do our best not to do that, and it's very rare. But we have to educate the patient before we do that these are the side effects.
But it sure sounds like that the benefits outweigh the risks typically.
Definitely the benefits would outweigh the risk. And again, in that initial evaluation, we make sure that the benefits outweigh the risk, and that's only when we would recommend the joint injection if the benefits outweigh any of the risks.
Sure. Yeah. Well, Dr. Balasuryia, thank you so much for spending time with us today. We are excited that you're on board with HSHS Medical Group and you're doing the joint injections. And if you need a joint injection or someone that you love or know does, come see Dr. Balasuryia out here at Panther Creek in Springfield. Thanks for joining us today.
Thank you for having me, Sonya.